Walker, and I'll be facilitating the Village's health presentation on Don't Let a Fall Spoil Your Holiday. Let's take a look at why I'm facilitating this topic. Falls are the leading cause of injury among older adults. In fact, every 15 seconds, an older adult is seen in the emergency room for a fall-related injury. 95% of all hip fractures are caused by falls. Falls are the leading cause of traumatic brain injuries as well. 1 out of 3 adults over the age of 65 will fall each year. Unfortunately, less than half talk to their healthcare providers about it. During the holidays, our risk for falls goes up greatly for the following reasons. There's more distractions and stress with all the different activities. Unfamiliar walking patterns and clutter occur in our house by rearranging furniture and adding decorations. We've got increased fatigue from more social activities, and often increased alcohol consumption or consuming alcohol when you don't normally consume alcohol during the rest of the year might lead to unsteady balance. Remember that house guests are also unfamiliar with different settings and may not anticipate trip hazards that you know are there and know to avoid. So for this presentation, we'll be looking at the risk factors for falls. Then we'll follow up with figuring out how we can manage those risk factors and reduce our risk for falls. I'll be including some holiday-specific tips about how to keep our balance and keep guests safe that you might not have thought of. A lot of the risk factors listed here have to do with changes in our body. At the top of the list is muscle weakness, especially in the lower body or legs. Balance and gait problems or walking problems. Maybe we're not able to walk nice and steady, but we have a limp because we've got a sore hip or some other issue. Postural hypotension is a change in blood pressure that causes a person to suddenly get dizzy or lightheaded when going from a seated to a standing position. Slower reflexes affect our ability to avoid an oncoming obstacle or to react quickly to it, to avoid tripping. Problems with our feet or wearing unsafe footwear also contribute to a greater risk for falls. Sensory problems such as change in eyesight or neuropathy in our feet can contribute to falls. Confusion because of dementia or Alzheimer's can affect a person's ability to multitask, putting them at greater risk for falls. And taking more than 4 medication greatly increases your risk for falls, perhaps up to 40%. So, in order to reduce our risk for falls, we're going to address those variables that were listed on the previous slide by staying physically active, even during the holidays with a different schedule. We're going to regularly review medications with the doctor or pharmacist, particularly if you've added a new medication and are not sure how it interacts with others. We're going to remember to have our vision and hearing checked and updated if necessary, making sure that we have updated prescription glasses to take with us in traveling, having our blood pressure checked regularly. Also, we need to assess our footwear. Footwear that used to be okay, that was cute, may have to be exchanged for something that's a little bit more sturdy and stable, even if it means sacrificing some of the holiday pizzazz that we'd like. And lastly, we're going to take a look and see what we can do to keep our homes safer for ourselves and our guests during the holidays. In terms of staying active, it's important to continue some form of exercise even during the holidays if your schedule has changed, to keep up your stamina and energy. Have a plan B for exercise option when traveling or visiting friends. Maybe you can't get into your gym, but you can go for a walk with the friend that you're having that's coming to visit. Or you can use other items, household items such as soup cans, for hand weights during this period of time when you're not able to go to the gym. Adjust your holiday. Some of you may actually have to adjust your holiday or travel activities. Excuse me. Some of you may have to adjust your exercise plans because keeping in mind that holiday travel and activities will consume extra energy, and you want to make sure to have an adequate supply left over when you go to meet your friends to keep yourself balanced and steady. Make sure to include the following components in your exercise routine. Remember, endurance, strength, flexibility, and balance are all important components. Endurance is cardiovascular exercise for your heart, such as walking, biking, or water aerobics. Strength training is helpful to keep our body steady because we lose up to 5% of our body strength per decade after age 30 if we're not doing something to try to maintain it. Flexibility is important to lengthen the muscles so that they don't pull on our low back and other areas of our body. Balance exercises should also be looked at. Medications have side effects, and some side effects are more likely to cause falls than others. So when you're looking at the medication bottle, look for side effects listed such as vision changes, dizziness, lightheadedness, drowsiness, impaired alertness or judgment. All of these can negatively impact balance. And remember to keep in mind that alcohol consumption can trigger additional side effects or elevate existing side effects. Looking at this list of high-risk fall medications, something that stands out to me is how common they are. Antidepressants, anti-anxiety drugs, antihistamines, blood pressure and other heart medications, over-the-counter and prescription form of pain relievers and sleep aids. Well, gosh, most of us take something like this every day, but perhaps we've never realized that they actually can be considered fall risk medications, particularly when taken with other drugs and mixed with alcohol. Our bodies don't come with a dashboard like cars do so that we can see if there's a warning indicator light telling us that something's about to happen. One way that we can do, one thing we can do to offset the fact that we don't have a dashboard like a car to tell us what's going on with our body is to make sure that we go in for our regular health screenings. Blood pressure readings can tell us if we're at risk for hypertension. Making sure that we have regular vision checkups are critical. Vision is the #1 sensory system that contributes to good balance. So make sure that you have adequate readers for you if you're traveling, and that your glasses are upgraded in prescription. Particularly if you're going to be doing more activities outside at night, such as looking at holiday lights, because depth perception is negatively impacted by the dark. Hearing is important as well. Make sure that you have you wear your hearing aids out so that you can hear sounds coming up unexpectedly that might otherwise startle you and cause you to lose your balance. Footwear. These are the components of a good, stable shoe. That doesn't sound like something that's attractive to wear, but it's critical because what you have on your feet is the foundation for keeping your complete body upright. Having good footwear stabilizes our ankles, and our ankle joint in turn stabilizes our knee joint, which in turn stabilizes our hip joint. You want to look for a good wide toe box or sufficient so that your toes can wiggle around and aren't cramped. If your feet begin to get sore and it's painful to walk, that's going to alter your gait pattern and perhaps make you at a higher risk for falls if your shoes are hurting you. One of the most important parts of a good stable shoe is having that heel. And ladies, unfortunately, if you're unsteady on your feet, wearing sandals is probably not the safest. Although I will say that if you find that your outfit is mandating that you've got to have a pair of sandals, there are cuter, more stable options available these days. Thank goodness. You want to have a cushioned midsole, not too high. And of course, make sure that you've got a non-skid sole. Keep in mind that many of our holiday shoes don't have that non-skid sole. And remember, when you're walking outside, if it's wet, that it's important to have that non-skid sole. Fall-proofing your home. When you're rearranging your furniture during the holidays to accommodate things like a Christmas tree or other decorations, you want to consider who's going to be in your home. Do you have a problem with balance? Do you need wider walkways? And now all of a sudden you've added so much that you really don't have that clear path? Do you have someone coming to visit that uses a walker or uses a cane, and you need to, again, make sure to have a wider walkway? You may find that if that's the case, you're not going to be able to decorate your house like you've become accustomed. Remove or avoid safety hazards. Improve lighting. Consider installing handrails and grab bars. And the last thing is, we may have to move items down from places to make them easier to reach if you've got guests visiting that are more frail. When it comes to rearranging some furniture for the holidays, let's take a look at some tips. Remember to never stand on furniture if you're trying to reach a high place to hang a decoration. Always use a step stool or ladder to reach that little bit higher, even if it is going to cost you time to go drag out that ladder. Notify others in the household when rearranging furniture. Don't assume that everyone has seen what you've done. Remove any unnecessary furniture and decor items to maximize space and reduce clutter. One of the ways that you can make sure to do this is after you're done decorating, stand back and enter your home from your front door. Look at everything that you've done with fresh eyes and think to yourself, if I have someone coming into my home that has trouble walking, maybe uses a cane, and is at a high risk for falls, do I need to make any adjustments to make sure that that person stays safe? Considering all the different risks, that holiday specific risks that we discussed at the beginning of the presentation, it may become necessary for us to remove some things that we hadn't previously thought of. I wanted to include a slide on ladder safety. As a reminder, use the ladder. Don't be tempted to shortchange, to save on time and not bring the ladder out to reach, again, that little bit higher spot on the Christmas tree. Make sure your ladder is secure and that the rungs or steps are clean and dry. Make sure to position the ladder close to the work area so you don't lose your balance when you're putting up decorations and lights. Again, it may be tempting to not take the time to descend the ladder and move the ladder closer when you're trying to string the lights around a little bit further around the other side of the tree, but it's really not worth taking a chance. And if you're using your ladder outside, make sure that it's on a firm, level surface. Beware of uneven ground or soft, muddy areas when decorating outside. And if ever in doubt about the steadiness of the ladder, make sure to ask somebody to come outside and help keep that ladder steady. Remove safety hazards that might cause somebody to lose their balance. Clean up clutter, small furniture, pet bowls, electrical cords, and phone cords. Again, look at your home with fresh eyes. Sometimes it's helpful to actually get down on the floor and look at the heavily trafficked pathways in your home from a different angle. You may find that there's things that would probably cause somebody to trip that you hadn't seen before because you're looking at it from a different angle up top, walking upright. Remove throw rugs. Use non-slip rugs or attach rugs to the floor with double-sided tape. It's best if you have any question about whether someone would trip over a rug to remove it. Avoid wet or slippery floor surfaces. Make sure that you're keeping an eye out for water on the floor if people are doing dishes and getting drinks out of the kitchen. Keep a sharp eye out for spills during the party and make sure that you have either a mop or paper towels ready at hand and nearby to pick up spills very quickly. Improve lighting. Make sure you have enough light in each room, even the rooms that aren't usually used, particularly if you have guests staying in them. Make sure there's a lamp within easy reach of their bed. Make sure not to hide any light switches in the rooms behind holiday decorations, making it difficult for guests to find them. As you see here, there's some pretty cool lights that are available that don't require electricity and operate on batteries that you can install quickly and easily alongside walls in hallways and areas of your home that may be dark. There's a lot of them that are motion censored and come on automatically. If you have grown more frail or less steady on your feet, or anticipate having guests in your home that are less steady on their feet than maybe in the past, you may want to consider installing handrails along your walkway. Grab bars are an excellent way to improve safety in the bathroom area. As you see here, there's some additional spots to put grab rails that you might not have considered. Most homes and villages have a single grab bar already positioned in the shower, but you can always add extra. Make sure to install them securely and have somebody install them that knows what they're doing. Just because a grab bar is attached to the wall, you have to remember that if someone grabs that bar and puts their complete body weight on it, it's not going to pull out of the wall. Something to consider also is purchasing a shower chair. Shower chairs are inexpensive and lightweight and can be easily put in and out of the tub or shower for someone. It's important to carry your phone with you around the house, particularly if you're at risk for falls and living alone. However, if you don't have an easy way to bring your phone with you, maybe consider a medical alert system. It's like an insurance program. You may think that you're not likely to fall, but all it takes is one time. And think about it as an insurance. If you buy the insurance, typically no emergency occurs. Make sure loved ones with memory impairment have a medical ID, particularly if they're going to be spending time with loved ones in unfamiliar locations. If you're a caregiver of somebody with memory impairment, make sure that you also have one on that identifies that you're a caregiver and that there is somebody with memory impairment that's attached to you. That way, if something happens to you unexpectedly, people will know to look for that person and make sure that they're safe as well. Consider making items more accessible. If you find yourself having to reach to high places to get those beautiful wine glasses that you don't typically use during the year, and that you're reaching over and putting yourself at a higher risk, also consider guests that are in your home that'll also be reaching for those items, and consider moving them to a different location, even if it's temporary during the holiday. And it's helpful to have a step stool handy in the kitchen to avoid the temptation of trying to reach for something that you can't quite grab without compromising your balance. If you have that step stool handy, people are more likely to just go ahead and grab for that instead. If you do fall, I wanted to review some of the tips to get up. First of all, if you fall, take a moment to lie there for a few minutes for a couple reasons. You want to get your mind back so that you're not confused or disoriented and you want to be thinking clearly. And then you want to check that you're not really hurt. Assess all parts of your body and also look to see if there's any bleeding that you might actually not have felt. If you have determined that you're safe, don't try to stand up on your own without some assistance of a sturdy object. Look for something sturdy and that you can pull yourself up onto, or crawl and maneuver yourself over to it. Once you have reached that sturdy object that you're sure will hold your weight and not topple over if you pull on it, Go ahead and move onto your knees. Bend one leg at a time and plant your foot firmly on the ground, using the stable piece of furniture to carefully pull yourself up. Take your time. There is no rush. Oftentimes, when people are trying to get up, that's when they fall again. Remain supported with your feet forward until you're sure you've got your balance completely, and push up to a standing position. Take time to recover and then phone someone to tell them what has happened. And lastly, remember that a fall can be an indicator of an underlying health condition, and that has nothing to do with your strength or balance. It may be something like a neurological disorder that's causing you to have this problem. So you want to make sure that you're not making assumptions. If you find that you can't get up, if getting up is painful at any point, stay put. You don't want to chance it. If you're not a doctor, you don't want to assess yourself. Use your phone or medical alert system to call for help. Stay as still as possible until help arrives, because you're not sure of what may have happened. And just because you don't see anything on the surface that's wrong, you don't want to assume that there's not some internal damage. So just don't take any chances. Some general guidelines of when to go to the emergency room, either yourself or someone else, is if there's a significant amount of pain or swelling. Oftentimes people don't want to, they're afraid of expense or afraid of the hubbub and attention of going to the emergency room. But if there's a significant amount of pain or swelling, that is your body's way of telling you that something's wrong. If you have a limited range of motion on a limb suddenly, any changes in alertness or mental status, headache, dizziness, or visual changes, go to the emergency room. And loss of sensation or movement in a limb, again, go to the emergency room. Any doubt about whether or not to go, always go. Talk to your doctor about the fall. Write down the information about when and where and how you fell. This will help them assess whether a medical issue is at fault or there's another cause that may need to be addressed. Knowing the cause will help you plan to prevent that fall in the future. And talking to your doctor will also help address the fear of falling. Often once a person has fallen, they've gotten more fearful and they start to do things that put them at a greater risk of falling, such as not walking or exercising and not getting up as much, which contribute to more atrophy of muscles, putting them at a higher fall risk. So those are some of the things to keep in mind that can keep you steady on your feet all year round, and particularly during the fall and the holiday season. If you have any questions, don't hesitate to reach out to the Villages Health Learning Center. If you've enjoyed this presentation or have any additional feedback of things that can be included or done differently, please take your cell phone and scan this QR code. Once you scan the code using your camera or the QR scanner on your phone, it should pull up an evaluation sheet. Your feedback is extremely important to us. Thank you and have a safe holiday season.